Hi, everybody. My name is Cynhia Hsu, and I am a third-year medical student at Chicago Medical School. The project I will be presenting today is titled Treatment of Topical Steroid Withdrawal Syndrome with Traditional Chinese Medicine, a case series of 10 adults. I collaborated with Dr. A Lio and Dr. Olivia Friedman. Topical steroids play a major role in the management of inflammatory skin diseases, and while they're generally safe and effective, topical steroid withdrawal syndrome, or what I'll be referring to as TSWS, can emerge after patients stop the use of topical steroids. In TSWS, patients can present with burning, stinging, painful skin, confluent or general redness, sometimes in a red sleeve pattern on the arms or legs, profuse skin peeling and flaking, and or thickened loose skin with reduced elasticity. Currently, there is extremely limited data on the incidence, risk factors, natural history, and therapeutic options for TSWS. This study aims to add to the growing body of literature that establishes TSWS as its own entity and highlights traditional Chinese medicine, or TCM, as a treatment option. For this project, we chose 10 patients who completed TCM treatment for TSWS between June 2018 and May 2023 at a specialty clinic focused on treating dermatological conditions using herbal medicine. The diagnosis of TSWS in this series was based on the clinical experience of the practitioner, the patient's dermatologist, as well as available literature. Patient charts and initial intake forms were reviewed, and the following variables were collected: age at diagnosis, initial diagnosis, length of TCS use, which TCS were used, symptoms at initial presentation, symptoms throughout management of the condition, psychosocial impact, and patient outcomes after TCM treatment. For results, in Table 1, we have the clinical histories of the 10 subjects in our TSWS case series. In Figure 1, the reported symptoms of TSWS. In Figure 2, the acute symptoms of TSWS reported before TCM treatment and after TCM treatment. And this figure is really highlighting these acute symptoms because through the TCM treatment lens, we really wanted to focus on the symptoms that would make the most difference in quality of life for the patients. And so those were the symptoms that we tracked for before and after treatment to determine how much patients improved with the treatment. In our first set of images, we have before and after pictures of subject 1 throughout their TCM treatment, mostly looking at the oozing and crusting on this patient's feet and the improvement by the end of treatment. In the set of images in image 2, we have the before and after images from subject 7, really looking at the red sleeves that is characteristic of TSWS. In summary, the history of topical steroid use in this cohort ranged from less than 1 year to over 50 years of regular use. An initial diagnosis of eczema was given to 9 out of 10 patients, and asthma and allergy comorbidity was common. Hydrocortisone 1% and triamcinolone 0.1% were the most used topical steroids, and half of our patients reported at least one course of prednisone. Treatment with traditional Chinese medicine reduced reports of erythroderma, thermodysregulation, oozing, itch and pain, and problems with sleep. The duration of treatment until symptom resolution ranged from 3 months to 13 months. In conclusion, TSWS is an important condition to consider when patients present with worsening symptoms after a history of TCS use. More studies are needed to better characterize the patients most at risk for developing TSWS. A growing demand for alternative and complementary medicine to TSWS suggests that TCM should be included as an option for patients. And finally, increased collaboration among practitioners is key to providing flexible and optimal care for TSWS patients. And on this slide, we have our contact information. Thank you so much, and I hope you are enjoying the rest of the symposium. Have a great day.